Recording from the Sunshine City, St. Petersburg, Florida, overlooking beautiful Tampa Bay, this is the Sonography Lounge, sponsored by Gulfcoast Ultrasound Institute. This podcast is dedicated to medical professionals and patients around the world interested in diagnostic and interventional ultrasound. Our podcast will discuss everything ultrasound, from news, trends, career paths, new technology, and industry updates. Hosted by Lori Green and Tricia Rio of Gulfcoast Ultrasound Institute, they bring over 4 decades of experience in the ultrasound profession and are here to guide you through this journey. Now sit back, relax, and enjoy.
Hello, everyone, and thank you for joining us today on the Sonography Lounge, where we talk about all things ultrasound. I am Tricia Rio, and I am here with my lovely co-host, Lori Green.
Well, thank you, and hello, everybody. We are here today to do a brief discussion on point-of-care ultrasound, primarily to dispel some of the misconceptions and biased information that we've been hearing while out and about at recent trade shows, professional society meetings, and just having discussions with some of our various medical professionals that we interact with on a regular basis. And as you know, we've been around a long time. We're in our 39th year of being involved with ultrasound education. And so we obviously, everyone here at Gulfcoast Ultrasound is very passionate about the use of ultrasound in clinical practice, ultrasound education, but most importantly, the evidence that supports that utilizing ultrasound in the clinical practice has a very positive impact on patient outcomes. Mm-hmm. So when we hear some of these things out there in the medical community, it's kind of frustrating to know that there's misinformation being spread that may limit or deter healthcare providers from implementing point-of-care ultrasound into their daily clinical practice.
Yeah, I mean, frustrating enough that we took it to get on this podcast today on the Friday before a large course and come on here and talk about this because we've been hearing a lot of misconceptions and just mistruths that we are here to kind of break through and talk to you about and provide you guys the information you need if you are considering utilizing ultrasound in your practice. So we're going to give you some facts, first of all, on how ultrasound can be used in your point-of-care practice, how you can implement that and integrate that. And it can be used in a variety of clinical practices and by a variety of providers. We're going to give you some information on the various equipment that's out there, options that you have, and how to choose what's best for your clinical practice. And then we're going to provide you with some resources for reimbursement, not only to help you cover that initial investment of the ultrasound equipment, but also to add a new revenue stream to your clinical practice. You know, reimbursements are being slashed every day, so we're constantly looking for ways to increase revenue streams in these clinical settings, and ultrasound, bedside ultrasound, point-of-care ultrasound is definitely a way to do that and is certainly reimbursable. So we'll give you guys some really good resources on that.
Absolutely.
Oh, yeah. Let me add, Lori, just so everybody knows, there's going to be a ton of information and resources shared today. So Casey is going to link all that stuff in our show notes for you guys. So be sure to check those show notes for that at the end of today's podcast episode.
Absolutely. There's some very valuable information that will be there for you to refer to after the podcast. So why don't we just get started here and just talk about point-of-care ultrasound, how it's being used in clinical practice. And oftentimes that is just a barrier right from the get-go because a lot of medical providers really aren't sure how to get started and how it really can be integrated into their specific practice for their patient population. So, and that's pretty much where you start, is you really have to assess your practice and what specialty area you're in, because point-of-care ultrasound can be used in such a wide variety of specialty practices, ranging from family medicine, sports medicine, MSK, emergency medicine, critical care, of course, internal medicine, hospitalists. So, and each one of these, although there's a lot of overlap in the applications that you would be utilizing that could best benefit your patients, you probably are going to have some aspects where you're going to streamline where you want to start, and then from there determine where you might want to expand your services once you become a little more comfortable and confident and proficient at your scanning and interpretation skills. So that's the first part, is if your practice is, maybe you're a family medicine, you might have your practice with a lot of OBGYN patients where another family medicine practitioner may not. And so those are two skill sets that are completely different. You might want to utilize it for general ultrasound applications, or you might be in a specialty practice that does a fair amount of interventional procedures. So you really have to kind of hone down where you feel that ultrasound will best meet your needs. And then also it's comparing the environment you work in. Are you in a rural environment where you have to be the person that does everything from emergency medicine, critical care, to general practice type of applications? And that's going to have an impact on what type of equipment you get, whether it's a handheld or it's maybe a cart-based system,
right?
The types of transducers you need to get, the types of education you need to get. So that's very important as well. And then deciding whether you're going to do diagnostic only or are you going to integrate some diagnostic and interventional skills. And many of you probably already are doing joint aspirations and things like that. So using ultrasound is just going to increase your accuracy rate and reduce the complications. So if you're doing those already, why not use ultrasound and get reimbursed for it at the same time?
Yep.
So those are some of the things that you might be interested in doing. It will fit right into your clinical practice. And like I said, the scope of ultrasound applications is there's quite a variety of them, from cardiac to
the list
trauma,
is long.
so long. We don't have time to go through all of those, but I think that's where you start out, how you want to initially address your patient population needs, where you feel it would be the greatest need, and then you can go from there as to how you're going to investigate the type of ultrasound system you want to get.
Right. I mean, your practice best, so it's always a good idea to do an assessment, decide what do I really think would be the most beneficial area to start. And there's nothing wrong with starting with one application, saying I'm going to do this, I'm going to learn this one application, and then I'll go from there. We've had multiple participants who've come in and done a course with us, and they're like, well, I really came here to learn how to do it for this. Most specifically, I hear UGVA, ultrasound guided vascular access. I'm really here to learn that. But then when they see, oh my gosh, I can assess for shock and hypotension with echo. Oh my goodness, I can do, soft tissue and foreign body detection with ultrasound and then guide myself to remove it. Well, I want to use that too. And what ends up happening is it just opens this door, and you still can start by mastering that one skill. We're not asking you to take on 15 different applications in one day. You start with that one skill, but then you see, look at how this can impact my practice. Look how this can impact my patients in a positive way. And before you know it, you're just addicted and you're learning anything and everything you can. So
right.
It really, you have no idea how you will use it until you start using it. So the moral of that story is just start.
Right. I mean, that the proof there is in just, if you take, for example, the emergency medicine specialty practices. We started doing our programs for emergency medicine back in 1994.
Right.
And we hear all the time, and it's just, you start out with learning some core applications that you're going to benefit from, being able to get to a more rapid diagnosis, which then translate into quicker treatment and management of that patient.
Right.
So, but then after you learn all these other things and you see how other people are integrating these skills and how it benefits their patients, you're like, okay. And then you just start trying other things, and the next thing you know, you've got multi-modalities and multi-organ applications that you can do and effectively, and your patients are super happy for it.
Right, because you're sitting there, you're scanning them, you're talking to them, you're showing them what you're seeing. It's definitely a game changer, And as you mentioned, ER critical care, those applications using ultrasound bedside existed before POCUS was even a word, right?
Exactly.
Like those things have been around, and the audience, I think that we're seeing a lot of these misconceptions and myths seems to be the family medicine world, seems to be that internal medicine, family medicine world, because they're fairly new to adopting these applications into their clinical practice. So, that was a lot of our reasoning. Is we've seen how ultrasound has impacted the emergency medicine and critical care world through our experiences and education. We've heard the stories. We've talked to people at ASAP when we go to those trade shows. We know the impact it's having. And now that's going to kind of, funnel over into family medicine. And then we're hearing these other things being said where it's limiting And it's making them think, oh, I can't do this because I won't get paid, or I can't do this because there's only this one system and it doesn't provide me everything I need, and that's why we're here. Is we just want to make sure that this audience who is new to this platform, who is thinking about integrating this, that you have the information you need to make a good decision, a good informed decision. So
That's right.
that's why we're here.
Yeah.
So I think, we've kind of covered the variety of applications, but let's talk a little bit about equipment.
Right.
It can be a daunting task to say, well, what system should I buy? And there's so many out there. You have so many options, and equipment companies are just throwing information at you. So let's talk a little bit about the things that you need to consider when you're going to decide what would be the best system for me. There's handhelds. So you hold it in your hand, it fits in your pocket, it connects to your phone or your tablet. Then there's cart-based systems. Some of those are also handhelds. Those are called hybrids. So it's a cart-based system, but it also can be connected to another iPhone or tablet or a device that's on a cart that you can wheel through the facility. And then there's, your radiology suite level machines that your sonographers are using in the outpatient and inpatient settings. And those are typically a little bit more than you would need in a family medicine, internal medicine, or outpatient situation, especially if you're somebody who's going to be traveling with your unit and you want to go from point A to point B. If you're a hospitalist, say, you would want the portability of something handheld. Right. So I think that's one of the first things you have to think about is what kind of system would best meet my needs. So I want something that I can carry in my pocket, but also put on a cart in my office, and those are the questions you need to be asking when you're looking for systems and you're talking to the representatives. What kind of options do you have for me? But I think it's more than that, and I think the moral of the story here is your needs. We're always talking about money. We're talking about our budget. What can I afford? Well, it's not going to help you to buy a machine that you can afford, but you can't use. So don't look at the budget first, look at the needs first, and then find what systems fall within your budget that meet those needs.
Right.
That's a better way to look at it.
Absolutely.
And then, there's other things you need to consider. Image quality is huge. If you have a system and it produces a non-diagnostic image, that's just as bad as not having a system. So you need to be looking at the image quality. You need to be looking at what variety of applications come with the system. Do you have to pay extra for every application you want the system to be able to do, or are they all included? What are your transducer options? Does the machine let you switch between transducers? Is one transducer serving several functions? And, the more you know about ultrasound, the easier it is to have those conversations. But you can get minimal education to get that down and to be able to have a intelligent conversation with somebody about that. We talked about portability. If you do have a handheld, you need to consider the battery life. Are you going to be in a situation where you're doing in-field care? Well, a battery will matter to you. You need to know how long that's going to last. Image storage. A lot of these handheld systems come with subscription-based storage options, so that's a question to ask. How do I store my images, and is there a fee for that? And then ease of use, availability of service. If you need help or something's not working, how easy is it for you to get somebody out there to help you with that system? And then warranty. What does it come with a warranty? What happens if you have it for 2 weeks and you drop it and you break it? Well, now what? Are you just out the money, or is there a warranty that'll cover that? And then lastly, price. Obviously price matters. We all have budgets, but I think all these other considerations need to be discussed, and then you say, okay, with what I need and what I want to be included, here's where I'm at, this is what I can afford, and then you have a platform to start talking to representatives about that. So, I think having an idea of what applications you want to scan, like Lori was talking about, is a great place to start, and then you can kind of go through this checklist about the equipment, find out what you absolutely are negotiable on and what you're not negotiable on, and then, call those representatives and do a demo. And, Laura, you were saying 3 demos, 3 patients to demo?
Yeah. Yeah, we always recommend, because, we get that. That's the question we get all the time. If you were buying equipment, which one would you buy? And, of course, we are very unbiased in our recommendations, because all of the systems out there are really good that we work with are really good quality, and they all have benefits and features that can meet or exceed your needs. But it's up to you to really decide, because everybody's definition of what's a good quality image can be different, and because there's different gray shades. What application you're performing, there's usually presets that have certain grayscale settings, and some people like images that are more contrasty, some like more grayscale. Certain areas of the body are better imaged with more gray shades than some other ones. If you want really good edge detection, a little more contrast, helps to see the borders of structures better and things like that. And once you get to know a little bit more about ultrasound, then that all makes sense to you. But I think the important thing is that you should have your list of items that you want to make sure that you have. And Tricia went over, some key points there that you should be looking for when evaluating equipment. But you also want to make sure that you're comparing apples to apples. So once you've narrowed it down to the systems that will fall into the category that you need, then you actually want to demo those systems and invite those reps to bring the system in. But you need to have some standardized model or standardized patients. So pick a couple people, 2-3 people in your office that you work with that are going to be around all the time, and you scan those same 3 people. You've got your checklist, and so you're doing a fair evaluation from system to system.
Yeah.
Whereas if you just bring in random people that are different body habitus and you're scanning with different systems on different people, you're really not comparing them fairly or equally. So then you can judge on image quality, ease of use, all of those things that Tricia went through, and know that you did a fair evaluation. And by the time you've done that, then you're going to have probably narrowed it down to a couple systems, and then at that point, they both have what you need. It comes down to price, and you negotiate the price that works best for your budget with those companies. And then you're going to be happy. We talk to a lot of people who just randomly go out and buy a system because someone said, just buy XYZ, and they go buy it, and then they go to a course and they find that maybe that system isn't the best for what their particular needs are, and that they probably should have looked into it and done their due diligence to really evaluate what the variable factors are. And if you've never done ultrasound before, that is definitely an overwhelming aspect. So that's one of the reasons why we're talking to you again today, is that to help you to be more informed as to how to best get started into performing ultrasound, whether it's family medicine, internal medicine, hospice, any point-of-care market. If you're new to it, you've got to learn the basics in order to be able to make the right decisions.
Yep.
So.
Yeah. Well, and I think, so we've talked extensively about the applications you can do. We've talked about the equipment. And I think the one thing, and you just said it best, is it's overwhelming, especially if you've never handled a transducer before, you don't utilize ultrasound. It's a whole new world. There's new language. There's just so much to learn. So, what's your opinion on that? What is the next reasonable step for somebody who wants to integrate ultrasound into their clinical practice after they've decided what applications and what equipment they may want to purchase?
Well, most definitely, ultrasound is not something you're going to be able to integrate into clinical practice without some skills training.
Right.
You can choose the educational format that best meets your needs for getting the didactic component. You can do your lectures in go to a program that offers traditional education format with lectures and hands-on. You can do a blended course where you do your lectures online at your convenience and then go to a hands-on only workshop, or perhaps have somebody come to your facility, or you do a private one-on-one, whatever works best for you and your scheduling and your time needs. But just doing your lectures online and trying to get your education and then go from an online course or online video alone or an article and then just buying the system and trying to scan your patients, you're not going to be successful. You're going to get frustrated. You have to learn the basics. It is a skill. And the only way that you're going to perfect a skill is to get scanning experience working with expert instructors that can give you the guidance that you need to be able to optimize your images, first and foremost, be able to recognize your normal anatomy and what those normal sonographic characteristics are, and be able to differentiate pathology from artifact. Mm-hmm. And that all comes from a combination of getting the didactic lectures and combining that with the hands-on skills training. There's nothing that can take the place of that. So if you want to be able to effectively integrate these skills into clinical practice immediately, then you need to, go into it with the mindset that I've got to take the time to get the education and do your due diligence to research where to go, because that makes a difference too. cheaper isn't always better.
Right.
And there are a lot of components that go into education that are super important to whether you actually learn it to the point where you can go back and put it into practice, and or whether you might be a little bit more overwhelmed than when you walked in the door. So I think that's important to that. So there's different things that you should look for when you're evaluating your training options. And also looking for a course that offers the topics that are going to be specific to your practice needs.
Right.
And so maybe you don't need to, at this point, go to a program that has all of the core elements that are outlined in the ultrasound practice guidelines. Maybe you only want to learn how to do vascular access or nerve blocks or focused cardiac or something like that. But if you're going to be working out in a rural or austere environments, or, you're probably going to need to know eventually how to do all of those different applications. So you can choose how you want to approach that for all-in-one, and then work on that, or one and then expand your applications. But I think it's very important to recognize that the skills training is crucial.
Yeah.
And just getting an ultrasound system combined with an online course alone is definitely not going to work for you or anyone.
No.
It's unless you've already been performing ultrasound.
Yeah.
But even that, if it's a new skill set that you're cross-training, the way you scan is different from one application to another. So the skills training is of the utmost.
Right. And we've heard people, numerous participants who have come through our courses who say, coming here, like I've been doing this very skill with ultrasound in practice for a year, 2 years, 3 years. Mm-hmm. But coming here and getting the tips and the tricks from the faculty and the hands-on instructors, that's a game changer. Now I know what to do when I'm faced with this, when I can't see this, another window. Where can I put my probe in a different place to try to access that view, to see that structure that I'm trying to see, or even just, like you said, optimizing the image, just the things we may teach you during a clinical instruction on the machine about how to change certain settings on the machine. I mean, I can guarantee you, even if you've been trained in ultrasound, most of you probably don't know what dynamic range is. Well, that's what we're here for. We can walk you through and show you how adjusting that will change your image and how it'll help you identify that pathological finding before you couldn't see it. So there is nothing to replace the hands-on skills training. And we're not talking go to a seminar and it's 10-1. We're talking small group, hands-on, focused training. So in our courses, we do not exceed a 3-1 for that reason, because if you get more than 3 people in a group, you don't get enough scan time to actually make anything out of it. Like just putting the probe down and moving it around a couple times isn't going to help you. We have to really sit there and walk you through how to even hold the probe, how to put your arms so that you're not going to end up with a musculoskeletal injury yourself, how to position the patient, what to do, when they should take a deep breath, when they should roll on their side. These are all things that we sit there and go over with you in the 3-1 groups, and we have time to do that because we limit them to 3-1. So.
I mean, there is value in watching someone else scan, but it does not take the place of you actually getting a sufficient amount of hands-on scanning yourself.
Right.
And I know, for a fact that there's a lot of people that are new to ultrasound, and you watch maybe an experienced clinician or sonographer that's scanning. They've been doing it for a long time. It looks so easy, doesn't it? We can just whip that scan, scan that patient with no problem, but that's years of experience.
Right.
And practice makes perfect. So even if you go to a course, you're still going to have to continue, learning. That's the one thing about the ultrasound profession. It's constantly changing. It's very dynamic, and the learning is ongoing. It never ends. So,
very humbling.
Yeah, new technology, new techniques, new AI. I mean, there's all new things that are always coming out that you have to learn more about. But I think it's important to remember that it's not like it looks easy, but it's not like you're just waving a magic wand over somebody's body. There is a skill to that, and each application, it could be just a minute little adjustment,
Yeah.
and that makes the difference whether you get the appropriate image or not. And then also to recognize that there are differences. And of course, from a handheld to a laptop to a cart-based system, and how many controls that are there for you to optimize. But in the end, ultrasound is ultrasound, and it works the same regardless of the size of your system. And you have to understand how to adjust what controls you have available to you in order to optimize the image so you don't make diagnostic errors.
And how to interpret what you're seeing.
Yeah, absolutely.
Yeah, very true.
Yeah.
Well, I mean, I think that, coming to a live course would always be my first preference if I were going to receive any additional training. I mean, I'm a sonographer by trade, and I went to school for ultrasound. That's how I learned. And it was months of clinical rotations. And I still left school feeling not very confident and not very sure of myself. And it wasn't until I was probably 1.5 to 2 years into clinical practice where I was like, okay, I have this. So the learning curve is steep. It is definitely a real thing. It is frustrating. It's going to be difficult to learn. But if you're committed and you look at it as a challenge that will bring you joy and excitement and something new to do every day, then you're going to be all right and you're going to get through it. And if you focus on the impact it's going to have on your patients, it'll all be worth what you're putting in.
Right.
So,
and you have the choice of taking baby steps.
Yeah.
You went to a full-blown general
I
ultrasound
learned
school, and it
3
all got thrown to you.
applications,
But
yeah.
as a clinician, you choose what you feel applications are going to best
very
initially
focused.
to start with, and you can go with core applications that are, low-hanging fruit, that are a little easier to learn.
Yeah, smaller learning curve. Yeah.
And graduate to other things.
Yeah, and it builds your confidence to
build
do
your
that.
confidence,
Yep,
right.
which
Absolutely.
is important.
Right.
Yeah,
So-
nobody likes to feel like they don't know what they're doing.
You got that right.
All right. Well, like I said, it's the Friday before a big course, so we don't have much time.
Yep.
So we are going to wrap this up with a brief overview of our reimbursement. So we're not billing experts. We're not here to tell you how to bill. We're not here to walk you through the whole process. Hopefully you have a billing department that can help you with that. But what we want to do is give you some information and some resources that you can use for billing for ultrasounds. And I tell you, the resources are out there and they are abundant. They are everywhere. A simple Google search will get you 15, 20 different articles that'll lead you down a road of how to bill, what to write, what's required in your reporting, what CPT code do you use, what modifier do you use. And I mean, when I did take a billing class as a sonographer. I was working privately in a vascular surgeon's office, and so I felt it helpful for me to learn how to do certain billings. So I did take a course, and I tell you, that language sent my head spinning. And I went through ultrasound physics, and I was like, CPTs and modifiers and all this stuff. But trust me, once you get down to the nitty-gritty of it and you focus on what you're doing in your practice applications and look specifically at those CPT codes, what's required, and how do I put in a code for that for billing, it becomes very simple and very clear cut. But we're going to go through it. So what we're going to do is we're going to first take a look at this reimbursement chart Case is going to put up for us. This was taken from the National Library of Medicine. It's an article titled Billing I AIM, a novel framework for ultrasound billing. We are going to link that in our show notes. 2 of our very own faculty contributed to this, Dr. Michael Press and Dr. David Boehner. And this framework identifies common errors that lead to non-reimbursement and outline what you need to get appropriate reimbursement. So if you look at the things in blue, those are the way we get paid. So we have our indication first. We need a billable reason to perform an ultrasound. And you can just look at an ICD-10 list and pick one of those codes that makes sense with your patient's symptoms and why they're being seen and why you want to perform an ultrasound. Then acquisition, the examination's performed. You got to save some images. You have to have a way to store those images. You need to label those images, measure things. So that's our acquisition. And then we move into interpretations. We're going to document what the ultrasound showed us. What are we interpreting that this ultrasound is telling us? And then finally, the money component. You put together the CPT code, go through the claims, decide, what's your payer and what is your reimbursement level going to be at. So when all of those are completed, you have what's called the true scan, according to this flow chart. The physician documentation and the saved images results in a true scan. At the bottom, red, what we don't get paid. So these are the mistakes that people make that end up in them not getting paid. So maybe they're using an ICD-10 code that doesn't qualify for an ultrasound. It's a non-indicated, doesn't support the CPT code for the exam that you're performing. Or we have a blind scan where the physician documented stuff, but he didn't save an image. So wrote in the medical record that you saw X, Y, and Z gallstones, for example, when you did a limited abdomen. But if you didn't save any images, then if you don't have images, it never happened, right? So don't do that. Illiterate scan, that's where you saved an image, but then you didn't document anything in the patient record. We all know when you bill something to insurance, you have to provide your notes, the medical record, as part of the billing process. And so you have to have something in there to support what you're saying and what you saw on ultrasound. And then the miscoded scan, that's where the CPT code, your scan doesn't actually fulfill all the requirements of the CPT code. So a really good example of that is billing for a complete abdomen when you really only looked at one organ. That does not qualify for billing for a complete abdomen. That's an abdomen limited. So if you're going to just look at the gallbladder, you got to make sure you're using the appropriate CPT code for that. And then there's the phantom scan. And you're going to do those in your clinical practice. There's going to be times where you're going to use ultrasound and you are not going to be able to bill for it. And that's more of your things that are critical. You're hurrying up and getting an image and looking, like you have a patient who came in and they're short of breath or unstable, and you're just trying to get a clinical answer. And, you're not going to take the time to document and annotate and do all those things. You're just trying to get information to make a clinical decision to save that patient's life.
Yes, no answers.
Yeah, yes, no answers. So those types of scans, those are the phantom scans. We don't expect to be billing for those types of scans. All right, so now that we've covered that chart, and I'm going to have Casey, can you link these in the show notes, these images? Okay, great. So he'll put these graphics and the images for you guys to refer back to, but you can also visit the link that'll be in the show notes, and it'll take you to this article where these images as well. Now let's take a look at this reimbursement chart. So this is the common CPT codes you're going to see when you're utilizing point-of-care ultrasound. You may not use all of these. You may use some of them. But these are some of the most common ones. So like you can see ultrasound guided guidance for needle placement. So say you're doing an aspiration and you're going to use ultrasound to guide your needle into the pocket of fluid and draw it out, and then use ultrasound to confirm you got out as much fluid as you possibly can. So there's your CPT code. All of these can be found online. It's very simple to look them up. And then you just have to decide which one best meets the criteria for what you're performing or what you want to do. And then you need to understand the components of that scan. What is required by Medicare to consider that an exam. So we're going to look at those. As we go down the list, you can see there's arthrocentesis, there's duplex scan of extremity veins, unilateral or limited. You're going to look at one section of the leg. And then at the very bottom, you see the modifiers. This is where it gets a little more confusing, but I tried to make this simple for you when I put this chart together. A limited ultrasound that there's not really a code for. So there's not a code for a transvaginal ultrasound, but you would code for the GYN scan with a modifier of a 52. And then there's the technical component. So if you have a machine that is owned by a hospital and maintained by the hospital, it's not your personal machine, but you're utilizing it, or a facility, if you're working inside of a facility, it's their machine, you can't bill for both components. You can only bill for the professional component. So the modifier 26 means that you're billing for the technical components, your own personal machine. So you'd bill for both the professional and the technical component, which is called the global charge, and that's where you get the most reimbursement. So it does pay to have your own system, is what I'm trying to say. And then the distinct procedural service, that's basically where a service is distinct or separate from other services that were performed that same day. A lot of times with ultrasound, they don't allow you to perform multiple procedures or exams in one day. Well, if you add that modifier code and saying this service or procedure was distinct from this one and needed to be performed on the same day, then with that modifier 59, you'll get both of those paid and they won't kick back one of those codes. So while we have this chart up really quick, this is a lot, and I can hear some of you right now going, this just seems overwhelming. This seems like a lot of extra work. I don't have time as it is. How am I going to integrate this? But I also know that some of you are having those conversations with your administrators about your bottom line, your profitability, and you're looking for ways to increase your revenue streams. So let's just give you some examples of what taking the time to integrate this would do for your practice. So if you're going to use ultrasound-guided needle placement, you're probably already doing the biopsy or already doing the aspiration or the injection, but now, and you might even be using ultrasound for it. That's the kicker here. I know how many people are actually using ultrasound to do this, and they're not billing for it. All you have to do is submit that CPT code with an appropriate diagnosis code, and you're going to get $59.52 for every one of those that you perform. It doesn't sound like a lot of money, but if you add that up over how many you're doing weekly, monthly, yearly, you're starting to pay for the investment that you made on that equipment and that education. Let's take a look at the duplex scan of extremity veins, bilateral. So you have somebody come in, they have bilateral swelling. You're just trying to find a reason for this because it seems that their heart's okay, so you don't think it's related to that. So you do both legs. A bilateral venous is going to pay you $195.87. That's the global charge. That's a lot of money, especially if you're somebody who's working in a facility where you're doing multiples of these in a day. And you can even have a sonographer who's performing these. It's your machine, but you have the sonographer. You can still bill for these and be reimbursed for these. That's how my vascular surgeon did it. I performed the exams. It was his machine. He billed for them. It brought a whole new profitability stream, income stream into his business that really helped him and helped him grow. And now he owns his own building and is extended his services. It's really just changed the dynamic of his entire practice. And then the last one that we'll go over, arthrocentesis. I know a lot of you are probably doing those in your office. If you add the ultrasound guided component to that, it's another $84 that you get to slap on for that. So, I mean, if you're already doing those procedures, you're going to make it safer for the patient and have a better outcome if you use ultrasound guidance, and you get to bill for it. And then if you're a primary care doctor and you're doing aortas, or you want to start aorta screenings, things like that, there is a Medicare specific code for participants of Medicare who are first time, like they're brand new to Medicare, and you're going to go ahead and do a screening real quick on their aorta, that you can get paid up to $111 for. So definitely worth utilizing the ultrasound. So I think basically all this just demonstrates you can bill for the ultrasound. The resources are out there. We're going to provide them in the show notes, and you can recover that initial investment. Plus you can add the income stream. But while we're talking about it, it's not just about the money, right? Like, we're offering a new set of diagnostic services to our patients, right? We're reducing ionizing radiation, because instead of sending them for a CAT scan, we're going to or do an x-ray, we're going to look with the ultrasound. We're reducing their costly copays, because now we're just performing it in the office, and that's going to be a much smaller copay for your patient. It could even be considered part of their visit for their copay, instead of sending them out to have this done in an outpatient imaging center where their copay could be $300-400. You know, if you're dealing with a population of people that doesn't have that kind of money, this is going to be a game changer for them. And in a relatively short amount of time, your skills are going to improve. You're going to start using this in multiple applications, and you're going to be able to, make clinical decisions without the delay in care that having to turn your patients over to outside imaging would create. And you're going to improve their outcomes and improve their patient satisfaction, which you get into the MIPS and all that funny stuff about reimbursement. I'm sure if you're doing that, you know what I'm talking about right now. And patient satisfaction scores are tied to your reimbursement. So let's get those scores up utilizing ultrasound. And the best part, you have a new toy, a new skill, which brings you joy as a provider. So
yes, absolutely. And back to the patient satisfaction.
Yeah.
Just being able to scan your patient right there at the bedside, turn the monitor and show them exactly what you're seeing. That gives them the confidence in you that they're getting an accurate diagnosis. They're finding out right then and there, and they can move on to treatment and not have that delay. That is really going to be huge. In patient satisfaction.
Yeah.
Seeing is believing.
And provider satisfaction. Yeah. Everybody's going to be happier. Yeah.
So really, really, it's really an important tool to integrate. And I know that the billing part sounds a little bit overwhelming. It's a lot. But, if you tackle this right from the very beginning of what are your needs, then what type of equipment do I think I'm going to need? You're going to probably go back and forth on that a little bit. And you evaluate the billing and the CPT codes in advance, and you already have that foundation. Yeah. It's not going to be overwhelming to you.
Right.
It's basically you got to take it in baby steps, but the process is really not that overwhelming if you just take it in steps and don't wait till the end to kind of figure out the billing. Kind of look at that all together as a package. This is what I need to do to get started and to be able to provide these services.
And there are just so many resources out there.
Right.
I'm not kidding.
Absolutely.
A Google search will prove to you what I'm saying. So much helpful information out there, charts and tables and all sorts of stuff to give you everything you would need to know about what to do, what to submit, and how to do it.
Yep. And we're going to get you started with some information in the show notes, and then you can take it from there, and we'll be having other references and resources available to you as well moving forward into the future.
Yeah.
So we hope that this episode has helped to break through some of these common misconceptions and myths about POCUS ultrasound, and to provide our listeners with resources and knowledge and tools that you can make a more informed decision on how to get started into integrating POCUS into your daily clinical practice. And as we said earlier, we are very passionate, obviously, about ultrasound. We've been doing this for a long time. We've worked with over 180,000 medical providers since 1985, and we have seen it firsthand how learning ultrasound and integrating it into clinical practice has such a positive impact on the patient outcomes that you serve. So we hope that you will take that step and begin to look into the things that you need to start with just to get going in it.
Yeah.
Just do it.
Just do it. Yeah, and if you are interested in integrating ultrasound, we have a couple courses coming up, right, Lori?
Yeah, we do. We have several. We're going to put these in the show notes, but we do have some coming up in the near future. In March, we have ultrasound-guided vascular access. We also have emergency medicine nerve blocks, as well as ultrasound-guided regional anesthesia courses that are coming up in early March. And in April, we have a 3-day traditional format introduction to POCUS for family medicine and internal medicine. And so if you're in that specialty practice, you definitely don't want to miss out on that course. It's based on the AFP guidelines and ASAP guidelines and the core applications that you need to get started for multi-applications. And
you can bring your billing questions and we'll chat.
You can. And if you already have a handheld system, we have handheld systems here.
Yep.
But we also have a wide range of ultrasound systems from a variety of the manufacturers that are available and we'll be working with during those programs. But you certainly are welcome to bring your own handheld if you have it.
Yeah.
And we'll work with you on that and help you to get some of your questions answered that you might not fully know in order to effectively optimize your images.
Yeah. Yeah, so as Lori said, we will link our course calendar for your reference in our show notes. That way you guys know what we got coming up in 2024, because there's a lot of really good courses on there. And then you can also just visit our website, look at any of our educational offerings. There's tons of things to choose from. So we want to thank you for joining us today in the Sonography Lounge. It's been a lot of fun talking to you guys. We want to make sure that you don't miss an episode, so be sure to subscribe to the podcast, The Sonography Lounge, so that way you will catch every episode, because all of them are full of great information. And of course, you get to listen to us just talk for an hour, which is always fun. You can visit our website, gcus.com. You can email us at learn@gcus, or you can get social with us on any one of our social outlets. We've got Facebook, Twitter, Instagram, half of which I don't even know how to use, but we've got people who do that. And we're also on YouTube. And then, as we said, make sure to check those show notes for all those links and additional resources. We hope you have a great day and happy scanning.
Happy scanning.
Thanks for listening to the Sonography Lounge. Don't forget, if you like this episode, please subscribe and leave us a review on iTunes, Spotify, or wherever you get your podcasts. You can also find us on Instagram @Sonography Lounge and Twitter @SonographyLNG. If you have any questions, comments, or topic suggestions, feel free to send an email to us at sonographylounge@gmail.com. Have a great week, and scan, scan, scan.